Here we go. All right, and we are live. Hello, everybody. Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. But today, it's not just me. Actually, we have a very, very special guest. Dr. Wiegriff is here with us here today. And because, of course, you guys know he's joined the practice. It's official crew member here at Pure Plastic Surgery. So we're very excited to have him. And it's time for you guys to get to know him a little bit better. So please make sure to follow his IG. It's dr.garrett.wiegriff. And so just go over there, you get to know him, see some of his before and afters and everything else. But what Dr. Wiegriff does bring to Pure Plastic Surgery is something that we haven't been really doing in the past, all right?
Yep.
And he's got a ton of experience with this today. So we want to talk about the Drainless tummy tuck. I know. They've been asking me for years. You're like, Dr. Earl, why do I have to have a drain? I don't like these damn things hanging off of me. But hey, now we have it here, and we brought someone who's done a ton of these. All right, so take it away.
So, drainless abdominoplasty, or tummy tuck as it's more commonly referred to on social media. We're going to talk about exactly what it is, how it differs from a traditional abdominoplasty, and then get into some of the nuances for post-operative care and other things. So we'll jump right into it.
All right, let's do it.
All right, quickly we're going to go over what is involved with the traditional abdominoplasty. And the techniques are very similar up to this point. So we're removing the excess skin and fat from the lower abdomen. You can see where the incision is. It hides down in the bikini line. And then we do a muscular plication, especially for women that have had children or have had massive weight loss. We're bringing those abdominal muscles back together, doing an internal corset, pulling everything nice and tight. We reposition the umbilicus into its new position after everything's pulled nice and tight, and that incision stays nice and low. For some women that don't have a ton of excess skin, they may end up with a small vertical incision, but that's the minority of patients. And then the traditional technique, drains are coming out somewhere to drain the fluid from the space that we develop by lifting up all the skin and fat off of the muscle.
Right, so as he said, when we do this, right, in order to be able to do this plication, you basically have to lift the skin and the fat off the muscle all the way up to here, all right? And that leaves what we call a dead space, all right? And the body hates dead spaces, right?
Absolutely.
And so there's a couple ways to deal with that space. The most traditional way is drains, and now we're going to talk about a way to deal with that dead space in a totally different manner.
Absolutely. So, what is it? It's exactly like it sounds. It's very similar to the traditional technique, except we're eliminating the drains. So, as I said, it includes a muscular plication. For most patients, it also includes liposuction of the flanks to help improve that hourglass shape.
Definitely, and we remember we do have that 1 liter limit, and the 1 liter limit is just about tummy tuck. Whether it's drainless or with drains, the 1 liter limit is the same for any type of tummy tuck.
Exactly. So how am I able to eliminate the drains? So it's a modification of the technique that we were just talking about. That dead space that's created, we need to close it down somehow. So there was a technique that was created using progressive tension sutures. So those were sutures that help advance that flap of skin and fat down and re-tack it back down to the muscular fascia. So that's the main change in the technique that allows us to eliminate the drain. So that's the progressive tension sutures.
Okay, so what you're doing is basically you're turning a large dead space and you're closing it down as you move along.
Exactly. And so we have a little animation of that. So we have our patient laying down. This is the skin and fat that has been elevated off. And then this is them already running down the progressive tension sutures to tack that back down and close up that dead space and limit the amount of area where fluid can accumulate. And so this is just another animation of different ways you can do it. Some people do it in a running fashion. Other people just do simple interrupted, quilting sutures is what they call them, just sporadically placed. I do a combination of both of them. And one of the things we'll talk about with this technique, sometimes it leads to temporary dimpling of your skin. Again, it's temporary and it goes away as the sutures dissolve. But in the beginning of the procedure, it actually typically gives a two-pack appearance because it's straight down the middle and then a few areas down at the bottom. But that's only a temporary dimpling of the skin.
So tell me a little bit about that, because, I've always said, one of the issues with with this technique is that, and I think you're doing it a little bit different, but some other surgeons are using like a permanent stitch.
Yes.
Which can then lead to a permanent issue.
Yeah.
But you're not using a permanent stitch.
No, I
right?
use all dissolvable sutures that go away. Like I said, I do a combination of doing the sporadic quilting sutures down towards the bottom, but for the center part, it's typically just a running suture that brings everything down and closes up that space.
That's great, great. All right.
So what are the advantages of this technique? As Dr. Earl stated, patients hate drains, and I don't blame them. You know, what's associated with the drain? The pooling sensation, some pain associated with it. The annoyance of keeping up with drainage logs and, you know, knowing exactly how much drainage came out before we can remove those drains. And then no carrying them around, putting the little grenades that actually hold the fluid in your pockets when you're going out and about. And then you can shower more quickly. I don't know what your typical protocol is when you have drains in, but a lot of surgeons don't like patients to shower when they have drains in place. For me, if my patients are doing well, they can shower on post-op day 2, as long as everything's looking good.
Yeah, well actually for us, that would be similar. So
Okay.
I do, all our patients can shower 48 hours after surgery, even if they do have the drains.
Perfect.
So that part wouldn't change too much. And I thought, don't some of you guys like to like walk around and swing the drains around? No? No one? One person? Alright.
All right. So what are the trade-offs? Whenever we talk about any surgical technique, if there's more than one way to skin a cat, there's trade-offs for everything. And so there are some trade-offs for this, and the biggest one is probably some additional time in the operating room because I have to do those additional layers of sutures. That's usually about 20 to 30 minutes, sometimes up to 40 minutes if it's an extended abdominoplasty and we really did a lot of elevation that we're trying to pack back down. So that's the main trade-off for this procedure. We already talked about the temporary dimpling of skin. And then, you know, people ask like, what is the risk of getting a fluid collection after this procedure? Because that's a risk for either one of the techniques, with the drain or without its drain. And the data shows that that risk is very similar between the two techniques, and some meta-analysis actually show that perhaps the drainless technique has a lower incidence of seroma forming. So, you know,
that's the key thing there, because, you know, a lot of people are gonna ask, well, you know, since you're doing all those sutures and the quilting sutures there, is then the seroma rate 0?
Not 0,
right?
But it is low.
And even like similar like with drains, so even with the drains, is the seroma rate 0 even if you pull them out at the adequate time? Again, unfortunately, no, right? So the only way to have a 0% rate of any sort of complication is to not do surgery. So all surgeries carry some sort of risk, but this, you know, decreases the risk of these potential issues.
Yeah, and then the final thing I'll say is I always reserve the right to leave a drain if for some reason I feel like there's an issue I'm a little concerned about, or there was an abnormal amount of scar tissue or something else, or there's a previous seroma pocket from a previous operation that I saw in there, and I just want to make sure we're not going to have an issue. That happens very rarely though.
Okay, great.
So post-operative care, this is really similar between the two procedures. The big things with this, you know, in my opinion, are definitely wearing your post-operative garments, your fajas, and getting post-operative lymphatic massage is important, because if little small pockets of fluid do accumulate, they're usually able to be dissipated just with massage and garments. So it's really important to get the best result to do those things.
So a couple questions on that.
Yeah.
Because when I do my tummy tucks, you know, and I have the drains, I put them in an abdominal binder until the drains are out, and then they switch to your faja. So because you don't have drains, are they able to go straight to faja?
So most of the time I try to do that. Sometimes in the operating room, if it's been a long procedure, they had other procedures with it, we'll put them into a binder for the first day after surgery and then get them into the faja on post-op day 2. But yes, because we don't have the drains poking out anywhere, we can go right into the faja. And I try to do it in the operating room, but sometimes it's a little difficult at the end of the procedure, and we do it post-op day 1 when you come into the office.
Okay, so but overall a quicker way into the faja, so that's good there as well. And then the massage. So when I tell our massage therapists and our patients that I don't like them to do massage in the kind of the front central area initially. So the initial massages are all to the areas where we did the lipo, which is the flanks and the waist, and then of course a little bit to the lower back because of the muscle spasms. But because of this, are they able to do some massage in the front central area?
It needs to be a gentle massage, but yes, I do actually like it because I like to massage the front. If there's any fluid that's accumulated there, get it back to the other areas and down to the groin where the lymphatics are, and that, you know, we can drain it with our body's natural drainage system, the lymphatic system.
Through the lymphatic massage, getting it through there. So into the lymphatics, and of course eventually out the urine. That's how that works.
And then just normal post-operative stuff. I don't know if everybody's aware, but all patients go home with an incentive spirometer, a breathing machine to help them to help them take deep breaths after surgery. Yeah. You are going to walk around a little hunched over the first week or two after surgery because everything's been pulled real tight, but you straighten back up after week 1 or 2. And then we have a great device here at Pure Plastic Surgery is the Vena Pro.
There we go.
That I'm super happy about. That's one of the types of things I'm excited about joining Pure for, is because they go above and beyond with stuff like this. But this is a sequential compression device that you would use similar to something in the hospital to decrease the risk for DVT and PE. But you do need to get up, you do need to ambulate after this surgery to decrease that risk. Any one of our surgeries, we want you up walking around the day of surgery, day after surgery.
Yeah, that's exactly right. So, you know, other potential complication rates are the same, whether it's drainless tummy tuck or your regular tummy tuck, and the thing that we worry about the most are the blood clots, okay? So you definitely gotta be using your SCDs, your compression device. You gotta be up and walking at least 10 minutes every hour while awake, okay? So we can minimize those risks.
Yes. And then for exercise and returning to work and those kind of things, I really don't want you lifting weights more than 20 pounds for about 8 weeks after surgery. And that's not so much because of the drainless technique, but more because of the muscle plication. We just don't want that to pop before it had a chance to heal in. And then light cardio, I say usually around 4 weeks, people can start walking, doing light stuff, but no core exercises for at least 10 weeks after surgery.
All right, and so I have a question.
Yes.
You know, a lot of you know that one of the things that we use for our regular tummy tucks is Exparel, which is the injectable to minimize pain. You're using Exparel for these as well, correct?
I offer it to all my patients if they want to do it. I definitely recommend it. If you think you're a little bit of a weenie when it comes to pain, I definitely recommend it because that muscular plication is a little painful, and so Exparel does a great job with. Exparel is a long-lasting local medication that gets you through that first 48 hours of surgery without real significant pain from that.
So my question with the Exparel is, because typically when we use the Exparel, we do it along the muscle plication and along the incision. But because you have more of these kind of rows of sutures down, which part of it is attached to the fascia, are you putting Exparel along those different areas or just the muscle plication?
Mostly the muscular plication, and that's also where the majority of my progressive tension sutures are centrally, so that helps with the majority of that. And then there's just a few other quilting ones out to the side. But honestly, those quilting sutures helps things from shifting around, and people tend to start the healing process a little quicker because of that, and I feel like they tolerate this procedure pretty well.
Excellent. All right, guys.
All right, that's
the big stuff. Let's look at what it, let's see what it is.
This is a patient that had a history of massive weight loss and had an extended abdominoplasty, which we can still do the drainless technique.
All right.
And then another patient that had a midline scar from a previous surgery that we were able to completely get rid of. And then this is another patient, she had previous liposuction, but this is only 6 weeks after surgery, this post-op picture, and you can see a nice thin scar. Yeah, everything looks great.
That looks awesome. Check this out, guys. So this is one of Dr. Wigger's cases here. You can see, you see this here. This patient had previous lipo, but she has skin laxity, and it's something I've been telling you all for years now, right, Willie? We've been doing this for years. Where I always say, if you're gonna do both, I typically recommend the tummy tuck first, but a lot of patients don't want to do that, and it's because of the skin laxity. And so what happens when you do liposuction, then sometimes that skin can remain loose, and unfortunately when the skin is loose, it doesn't retract well, and it can create things, it can create an uneven look, all right, because the skin hasn't retracted well. And then typically the solution for that is then a skin tightening procedure, such as the tummy tuck. And so that's what you did right here, which is with a beautiful, beautiful, excellent result. So see how the belly looks here, it looks uneven, and a lot of people out there, they don't really know the difference, and they're like say, oh man, that's uneven lipo, that surgeon was terrible, he doesn't know what he's doing with lipo. And then what I've been trying to say for years and years and years is that it's not about that. It's not an uneven lipo. It's all about skin laxity. All right, and if you have loose skin, and it doesn't retract well, it's going to give you that lumpy, bumpy kind of look, okay? And so then the way to fix that is not further lipo, you're just going to make it worse. The way to fix that is to then remove the excess skin and do a beautiful, in this case, drainless tummy tuck, just like this.
And I'll point out what I was talking about, that dimpling. You can kind of see how this creates just a little bit of a depression right along the midline, but it kind of gives that two-pack appearance. That's the progressive tension suture. It's probably going to just smooth out over time as that suture dissolves, but there's really no dimpling anywhere else here, and she's at 6 weeks.
Right, and so with this technique, can you do like a little bit for the right candidate, of course, like a little bit of an HD kind of tummy tuck type of technique?
Yeah, we can. We just can't really cross that mid portion of the abdomen because we're preserving that blood supply. But yeah, we can definitely thin out, give a little bit of that soft etching with just carving out this area to the lateral aspect of the abdominal muscles.
Yeah, like a beautiful kind of soft edge athletic look.
Yeah.
Definitely no six pack. You can't do that. All right.
No.
All right. Awesome. Well, I think we're now open for questions. Okay, so we're happy to answer any questions that you may have. It can be regarding this specifically for Dr. Wieger here, for myself, or just plastic surgery in general. Go for it, William.
Let's go. Okay. When do you suggest a mini tummy tuck in older patient without skin hanging over?
So, all right, when would you do a mini tummy tuck?
So mini tummy tuck is applicable when someone does not have a diastasis, because you're not going to be able to address the diastasis through a mini tummy tuck. If they're, a middle-aged patient that just does not have great skin quality anymore, and they had liposuction, and their skin laxity is really localized to the lower abdomen, they're a great candidate for a mini abdominoplasty. What is that? It's basically just a smaller scar, but we're not doing the full dissect all the way up to the chest. We're not usually cutting around the umbilicus for that. And for some patients, I'll do an umbilical float, meaning I won't cut around their umbilicus, but I'll detach it from its umbilical stalk. But that sometimes brings the belly button down a little bit, so you have to really be the right candidate for that procedure.
Yeah, that's exactly right. So if you're going to do a float, then it's simply for that patient that has like a high riding, like a naturally high belly button. So how do you know your belly button is high? If you touch what we call the iliac crest, the bone out here, your belly button is typically around that height. And if it's a little bit higher than that, then you're a good candidate for a float, because that means that we can lower the belly button and it still looks very, very natural.
Yes.
Great. Can I get lipo to my back with a tummy tuck?
Okay.
So again, we have the restriction of 1 liter of liposuction in the state of Florida. So for most patients, in my opinion, that's probably not an option. For very select few patients that have very little excess on the back, it is a possibility, but it's not routine.
Right, I agree 100%. So, the rules are the rules here in Florida, and those rules apply to every single surgeon in Florida. Really, so what is the rule? 1,000 cc's of fat removal via liposuction when you're doing a tummy tuck. That's it, that's the rule. So, for most patients, you get 1,000 cc's just in the flanks and the waist alone. You can't really go to another spot unless it's like a small area. Like, we don't really get that much from the chin, right?
No.
So the chin will maybe contribute like 10, 25 cc, so that doesn't even really count. Or sometimes if the arms are not too thick, the arms don't contribute that much either. So things that we more commonly combine with the tummy tuck would be like a lipo chin or a lipo or body tuck to the arms. But the back is a huge area, right? That's gonna have maybe 2 liters in the back just by itself.
Yeah.
Dr. Earl, why do you prefer the drains over drainless?
Yeah, so I use the drains. That's my technique. It's what I've been doing for years and worked well for me. And so some of the reasons that were explained here. So number one, doing the drainless does take a significant amount of more time to the procedure. And one of the things that I like to do is I want to be as efficient as possible. So that's really one of the things right there. And there was a few things that at least I had learned from prior in my training, which may not be true anymore, which is great. But one of them was that a lot of times before they were using these sutures that were not absorbable, and when sometimes if these sutures can create the dimpling, it may not go away, or if there's like a little infection in that suture that's not absorbable, then you have to go back in to try to dig it out. But fortunately, I think a lot of these potential concerns can go away if we're using the right stitches and the right technique.
Yeah.
Can I get a skinny BBL if I already had a previous lipo done 1 year ago?
Right.
So that depends on you, what you have, how much fat you have remaining, and you would really need to be examined for us to be able to determine that. And then a year is really the minimum time I would go back to do any type of a revision, liposuction, because of the risk of contour irregularities, doing that too soon because of scar tissue still being a little too thick and tough.
Yeah, so I agree with that. Certainly nothing before 9 months. So remember, we're going to do the same procedure again. So say lipo 360 followed by another lipo 360 or BBL. We want to wait an absolute minimum of 9 months and ideally a year before you go back to do that. And then it really depends on how much fat you have left over and whether it's going to be enough to be able to perform that BBL. So we do kind of take it on a case-by-case basis. The best thing to do is to just go ahead and send your evaluation. So go to our website www.pureplasticsurgery.com. There you're going to hit the little virtual consultation button. You'll fill out the questionnaire, send your photos, and we're able to do that virtual consultation for you and determine whether you're going to be a good candidate for the procedure. What I can tell you kind of in my experience over the years, round twos are not that uncommon. Like we can do a round two quite a fair amount of the time. I would say probably even over 50% or so. Now as you start getting into like round 3 and above, then things start to get really, really tricky. Okay, so I'll reject many more like round 3s or round 4s than I would for a round 2. I think a round 2 is pretty doable, but after that we really have to evaluate a case-by-case basis.
Is it more complicated to do a tummy tuck on a patient that previously had lipo?
Yes.
Yes. So again, I've been trying to drive this point home for a long time. If you're gonna have both, it is much better idea to do your tummy tuck first. Okay. When you come back, like the photo, I'm sorry, it went off the screen here, but when you come back and do your tummy tuck secondarily after your liposuction, there's a few things that have happened because of the liposuction, which makes that procedure a bit more challenging, okay? You're gonna have a certain degree of scar tissue underneath there, scar tissue and fibrosis, okay? The skin is not gonna be as distensible, it's not gonna be as easy to pull down, okay? And depending on how aggressive that liposuction was, whether maybe it was done somewhere else and they used laser lipo or they use a high frequency vaser lipo, okay, you're gonna get rid of blood supply, you're gonna be getting rid of vessels, and so that makes it a lot more tricky as well, because when we are doing that dissection, right, we're lifting up all that skin and we're depending on the blood supply that's left over, and if that blood supply is not good, that can lead to skin necrosis, basically skin dying and open wounds, okay? So for all those reasons, it is a lot better in terms of less complications and also a better long-term results to do the tummy tuck first and then come back to do your lipo 360 or BBL. Your thoughts on that?
I've had an evolving thought process on that, because some people argue you do the lipo first to harvest more fat, but after now having done a few of those very difficult abdominoplasties, I'm shifting towards the other end of that spectrum, and I agree. I recommend getting the abdominoplasty first.
Yeah. Also the chance of having, I don't know if you all recall that first slide, but the chance of having that little vertical scar is higher when you do it secondarily. Again, because the skin just doesn't stretch down as far, and so it's a lot tougher to get it down, and you can't get it down all the way, then you are going to be left with that little vertical incision there.
Okay, Doug, is it true that laser lipo kills the blood supply?
Great question. Who asked that question?
The Valley Gorgeous.
All right. I love that question because it's something that we're going to be introducing here to Pure Plastic Surgery very, very soon. So that's a great question, and the reason why you kind of heard about this is because at some point in time it was true. I think the earlier Vaser machines, they were cranking up the energy quite high, and that was causing the fat cells to lyse, meaning to they basically burst open. And of course, if the fat cell bursts open, then it's not viable and you can't use it for transfer. But what's been happening over the course of the last few years is that, of course, the machine gets better and better. Think iPhone 5 versus iPhone 15. Okay, and the experience, right? The experience of all the surgeons using this machine has led to a place where we now have protocols where we can use the machine, okay, at a little bit lesser settings, okay, such that the machine still works well, but it does not kill the fat cells. All right, and that's awesome. So you get all the benefits of the Vaser, which means that typically the fat comes out, very, very nicely, very smoothly. There's less bleeding, okay, and there is more skin retraction. Okay, so all the benefits of the Vaser without the downsides that used to have, or the settings were cranked too high, of potentially killing the fat cells and then making them not viable for transfer. All right, so now we can use it, and da-da-da-da, and we have it. Yes, so we just got the Vaser this week, and so that's going to be part of our toolbox here at Pure Plastic Surgery, available for all our patients if they want to do the Vaser for their Lipo 360s and or their BBLs.
Awesome, I'm excited about
Yeah.
Or the Total Definer package.
Yes, well, of course, and most importantly, for that Total Definer package, which we did the live on this maybe 2-3 weeks ago.
Yeah.
So the Total Definer package, just to kind of just very briefly go over that again, that's where we're doing that kind of whole body transformation. So we're turning the body into that more athletic look, and now we're not just talking about specific parts or specific areas, right? We're talking about taking the patient or the person as a whole and doing everything that we need to do to transform that body into that beautiful athletic look. So that means everything's included. So we're doing HD lipo of the trunk, of the arms, thighs, back, whatever we need to do. We're adding the Vaser to that to help with the skin tightening, because in order for all of this to work, that skin really needs to retract down very, very nicely, very, very tight. We're adding the body tight on top of that, and even Morpheus if we need to. So the package includes the whole shebang, the whole deal. So we're, arms, thighs, back, abdomen, HD, everything.
And this is for our male patients too.
Male, yes, that's.
You want a masculine look? You'll get a masculine look.
That's right. So that's exactly right. Thank you for bringing that up, because it's something that's not being done in the U.S. very much, but when you go down to Colombia and Brazil, it's being done quite a bit. And so it's a whole body Total Definer package for men, where we're creating the actual six-pack. We're actually also, enhancing certain muscles. Like common ones are the chest and the deltoids, the biceps, triceps, and really creating that very muscular, masculine look as well. So definitely, men welcome, yes, for that Total Definer package.
Can we have one more question, Doc?
Sure.
We're on time, but this is a good one, and it's how long does one have drains in place after a tummy tuck?
All right, so if we are using drains for the tummy tuck, it does also vary from the patient to patient, because it depends on how quickly you heal, how much fluid is coming out. So the most time that you would ever have a drain would be 3 weeks, but honestly, for the majority of the patients, it's much less time than that. It's typically somewhere on average between 7 to 10 or 12 days for most patients. Here we get a lot of patients from out of town, and I would say the majority of patients, they get one drain out when they leave after post-op day 5, and then their second drain comes out, a couple of days later.
Yeah, Doc. Just to say goodbye and say our
The
preview?
promos?
A
Yeah.
glimpse of the promo.
No, but we're only gonna give a hint here, okay? All right, because we got something very big coming up for October, okay? So October, as you all know, is Breast Cancer Awareness Month. And so, we want to bring awareness to that, but not only, the cancer side of it, but the breast reconstruction side of it as well. And as you know, a lot of breast reconstruction is done with breast implants. And so we do a lot of breast implant surgery here as well. And so the company here is helping us sponsor some very, very, very good deals for October. Okay, that's it. I'm not gonna say anymore.
Until Monday.
All right. Until when? Monday?
Yes.
Okay. So you're gonna enjoy Labor Day weekend. All right. And when you come back, make sure you tune in to get our great deals for Breast Cancer Awareness Month in October. All right.
Awesome.
Okay, everybody. All right. Well, I hope you enjoyed this. Thank you so much for the presentation
Thank you.
here. Guys, please do not forget to go follow Dr. Garrett Wiggriff, okay, on Instagram. So it's dr.garrett.wiggriff. You spell it just the way it's on the shirt right here, okay? So go over there, follow. He's got you get to know him, and also before and afters and everything else. All right.
You can also find me from the main Pure Plastic Surgery page.
That's right.
Linked on there as well.
Perfect. Awesome. All right, everybody. Well, we look forward to seeing you next week on Hump Day with Dr. Alex Earl.